Welcome everyone to today's webinar, COVID-19 Takes Your Bedside Virtual, Tips to Build a Digital Workflow for Your Informed Consents. I am Laura Deirdre with Becker's Hospital Review. We will begin today's webinar with a presentation and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access the recording. At this time, I am pleased to introduce our presenters for today's webinar. Janelle Goss is a healthcare IT professional motivated to find efficiencies in system processes. She was born and raised on the Mississippi Gulf Coast and still lives there with her husband and fur babies. She enjoys spending time with family, teaching fitness classes, and planning and decorating for events. Desiree Paoli is a Senior Solutions Marketing Manager at Interlace Health and is responsible for developing strategic solutions that deliver significant value to customers and solve their defined healthcare problems. Desiree has an MBA in marketing and over 18 years of experience in marketing, advertising, strategic planning, and information design. And Ann Hill is a solution architect at Interlace Health. Ann has 25+ years of experience designing healthcare solutions to solve complex clinical and administrative workflow challenges. She lives south of Boston with her husband and 3 children and enjoys boating, paddleboarding, and spending time at the beach. At this time, I am pleased to turn the floor over to Desiree to begin today's presentation.
Thank you, Laura. I'm happy to be here today. One more thank you before we get started. On behalf of Interlace Health, I wanted to say thank you to all the healthcare workers out there who are maybe listening in today and who are working on the front lines of this pandemic. We are grateful for all of you. So a quick overview of some of the topics we're going to discuss today. Consenting in a low-touch bedside environment. We'll talk about understanding regulatory guidelines for consent and tips to manage them successfully. We'll hear how Singing River Health System successfully transitioned to an electronic process, and then we'll take a look at the ROI of electronic consents. So let's get started. Taking your bedside virtual. Consenting in a low-touch mobile environment. Informed consent is more than just a form. It's the vital communication that takes place between the provider and the patient about the procedure being recommended and the critical evidence that the consent occurred effectively. Ultimately, the goal of informed consent is to ensure the proper conversation happened with the provider, the patient feels like an educated participant in his or her healthcare decision, and the hospital has documented that this legal and ethical responsibility took place. But it's not easy to create and maintain fully compliant consent forms for every procedure. A well-designed form collects all pertinent information and provides the required education and alternatives to the patient. It's legible, which isn't always the case with handwritten information. It meets all CMS guidelines as well as state, local, or organizational requirements. It has been properly collected, scanned without errors, and archived securely in the EHR. And finally, it collects signatures from the necessary parties and records the date and time the consent took place. But many hospitals understand the problems with this paper process. 75% still use paper consent forms, even though most have been on an EHR for nearly 10 years. 67% of patients are missing consents on the day of surgery, and so they have to be collected again before they can proceed. But patients are under duress as they prep for surgery, and some states require consent to be collected 24 hours prior to the procedure. So as a direct impact of these missing paper consent forms, often up to 14% of those surgeries are delayed. And this data comes from a recent JAMA report. Nationally, it's estimated that 25% of nurse time is spent managing paperwork. Given everything they need to accomplish in a shift, this is an astonishing percentage. So as a result, an advisory board survey documented that 50% of clinicians reported often or always feeling burnout, with a leading cause of dissatisfaction coming from paperwork burdens. Do you know how much time staff spends managing the paperwork, or more importantly, how much excessive time they spend due to errors, missing information, or lost forms at your facility? Digging into these numbers for your organization is a valuable exercise to understand the implications of paper on your resources during this critical time. Let's take a quick participant poll. How do these national numbers compare to your organization? You can click on the answer on the screen that applies to you. Wow, do you work here? These are spot on. You're in the neighborhood, but not 100% accurate. Nope, our numbers are completely different, or I have no idea. We'll take a couple seconds here while everyone clicks on the answer that pertains to them, and then we'll take a look at the results. All right. It looks like we're in the neighborhood, but not 100% accurate, which is what we assumed because these are national averages, and there's a lot of geographic variation, we understand. Thanks for taking time to do that. So let's talk about how healthcare is changing. The COVID-19 pandemic has created what many have deemed healthcare's Amazon moment, and it's led most organizations to have to pivot quickly. Organizations have relied on technology to move the predominance of care from the hospital to the home with telehealth, meet CDC and government standards, while also meeting patient expectations and resource and space constrictions. So as a result, low-touch or no-touch communication options are needed now more than ever. We know paper is cumbersome and requires in-person or low-tech interactions that just don't satisfy the needs of the patient today. Mobile devices are preferred for online interactions as much as possible. And telehealth is the future. We've been hearing that it's expected to represent as high as 40% of healthcare visits moving forward. So let's take a look at what an electronic consenting process looks like. Ann Hill will now provide a demo so you can see the consent forms in action.
Great, thank you, Desiree. As mentioned earlier, my name is Ann Hill. I am a solution architect at Interlace Health, and I'm excited to show you how our informed consent solution really provides clinicians with an efficient way to automatically launch consents to capture patient signatures right at the point of care. Today, we'll be working with our patient, Amy, who is in pre-op preparing for her orthopedic procedure, and a consent needs to be collected prior to the procedure. I'll be highlighting the use of Interlace Health's mobile solution to scan Amy's wristband and automatically load consents onto a mobile device. And then once loaded, you'll see how the clinician can review the different components of the consent, collect signatures, and send the patient on their way to surgery, confident there is a complete informed consent containing all the necessary information in the patient's chart. So as a nurse, I'm logged into the app on a mobile device, in this case, an iPad that I've carried into the patient's room. I can tap here to scan the barcode on the wristband for streamlined, accurate patient identification. The camera becomes enabled. I can hover over that barcode on the wristband, and once that scanner has identified the patient, I'll be brought to any forms in progress that are available for launching. I'll tap here to launch the orthopedic surgical consent, and now I can use the form on the mobile device to obtain informed consent together with the patient. Notice the patient demographic information defaults onto the form from the EMR, eliminating the need to handwrite that in or attach any sort of a label. I can confirm laterality by choosing the radio button option. I will confirm that Amy is here for a total knee arthroplasty by tapping into the field and selecting that procedure. And notice when I do that, the description, alternative procedure, and other information that is important to review with the patient all default in from that procedure chosen, really streamlining completion and simultaneously, promoting standardization. I can also confirm and elaborate on the specific procedure using the annotation tool. I can circle the surgical site with my finger or stylus and confirm with my patient. I can also add any additional information that might be specific to Amy's case using free text or even the dictation tool available on my mobile device. Navigating to page 2, at the top you can see there are some embedded hyperlinks here to allow for some additional education on the procedure, really ensuring that my patient is truly informed before consenting to the procedure. And then moving through the form, I can indicate Amy will be signing as herself and Dr. Sawyer will be performing the procedure. Once I have finished reviewing the consent with the patient, I can tap into the signature box to apply, for Amy to apply her signature using her finger, or since this is a touchscreen device, a stylus can also be used. And when that signature is filed, a date and time stamp is automatically applied for auditing purposes, and also to ensure the consent was collected at the appropriate time according to, the specific guidelines of the organization. Dr. Sawyer can also apply his signature to the document, and once that document is complete, it can be approved, at which point it is archived to the patient record and viewable, at the time of the procedure by anybody who has access to that patient's chart, eliminating the need to print or scan or attach labels or send down to medical records. It is automatically archived as if it had been manually scanned in. That was a real quick overview of our informed consent solution. We looked at how clinicians can easily identify patients and launch the appropriate consent triggered from the procedure. We saw how clinicians can walk through the different pieces of the consent with the patient as an active participant in the informed consent process. And we also saw how providers and patients can sign the consent and submit it for automatic addition to the patient's chart. I'll turn it back over to Desiree, and I'm happy to answer any questions at the completion of the presentation. Thank you.
Thanks, Anne. Our next topic is improving workflows, understanding how regulatory guidelines for consent impact your success and also tips to manage them. So the maximum quality score with CMS for informed consent is 20 points. Content is key to getting this maximum score. CMS requires that the procedure information is typed and easy to read and understand for the patient, and that it includes the description, the clinical rationale with condition-specific justification, patient-oriented benefits, probability of procedure-specific risks, and alternatives to the procedure. And then time and date stamping is critical to show when the patient consented, when the provider reviewed, and that it happened in the preferred timeline for the organization or state guidelines prior to the procedure. An electronic consenting process allows you to more easily meet these CMS guidelines and improve your score while also creating quick and seamless workflows for your staff. As Anne showed in the demo, you can instantly generate the forms you need by barcode scanning on a wristband or on-demand form selection. These appropriate forms for the patient procedure are created based on HL7 messaging in the EHR. You'll also experience faster form completion with those pre-filled patient demographics and a user-friendly mobile experience for everyone. Procedure-specific content is automatically populated in easy-to-navigate variable form fields, like Anne showed, the radio buttons, the drop-downs, or you can enter it quickly with speech-to-text options on the fly. So you can ensure all of the CMS required content is included, typed, easy to read, and then the time and date stamp is there as well. So after the patient signs, whether it's in the clinic, hospital, or from home virtually, there's temporary storage of pending consents that are awaiting additional clinical signatures. And you'll have visibility of incomplete forms in a dashboard to prompt action throughout the care community and ensure timely review and completion prior to the procedure. Once all those signatures are captured, the final electronic form is instantly archived to the EHR, preventing lost documents, decreasing risk, and ensuring compliance. Now, I mentioned earlier that content is key to meeting regulatory guidelines, but it's also key to managing your consent process. Interlace Health can help you build a robust content library for your consents. We can use your pre-vetted content as a starting point or provide you with templates and content outlines that follow industry best practice. A digital process doesn't just improve the clinician and patient's experience, but it can also make life easier for the administrator who has to manage all of the forms and content and create drop-down lists of providers and procedures, and all of those changes will drive what procedure details are auto-populated into the form. So here's an example of a content library that we've created for a client, so they can see all of their procedure form fields in one location and easily review, edit, remove anything that needs updated, and instantly push those updates out to all of their forms rather than making one-at-a-time updates. You can see that you can easily define the form categories to match your template, and being able to export this document and share out with clinicians or your legal team makes quick review just easy and efficient for everyone. So that content from the spreadsheets is automatically plugged into the forms that Anne showed you. So the form's ready for you after just a few clicks. You have flexibility you need to edit and enter variations manually. And then you also have those variable text options such as fillable free text fields, checkboxes, drop-down lists, etc. So you can move through the process quickly and efficiently. And it's vital that the patient feels fully educated after reviewing the consent. So an option to link to additional content such as videos, graphics, or specific information on your website is important. It enhances the patient's engagement and understanding of the information being presented. And we know people are visual learners, and reinforcement is key. So added features that allow you to make annotations will enhance your conversation as you discuss the procedure with your patient. And then, of course, you need the electronic signature fields that time and date stamps the signature and lock data in to ensure validity of the content is documented and accessible on the day of surgery. So we're going to take another quick poll. Based on the information I just shared, has your organization considered electronic informed consent solution before? So click on the answer that applies to you. Nope, I didn't know it was possible. Yes, we're looking for a vendor now, or we already have electronic consent capabilities. I'll take a quick second, let everybody enter their answers. And now let's take a look at the results. So many of you already have electronic consent capabilities, so you understand a lot of these benefits. But maybe you'd like to hear how someone else has implemented it in their facility and the benefits that they've seen. Singing River Health System is a mission-driven health provider in the Mississippi Gulf Coast. When the healthcare organization decided to switch its paper-based informed consent process to one that was digital, it had numerous concerns to address and requirements to meet. Interlace Health was able to successfully help them navigate these issues and embrace the power of an electronic approach to the critical process of informed consent. Janelle Goff will now share that process with us.
Thank you so much, Desiree. So the product that was available to us through Interlace Health really set the tone for what we were looking for in this transition from paper to a digital solution. So why even go down this road to initiate the change? Well, we all are living in more of a digital age, and we knew that paper was kind of that last little piece that needed to move digital, and consent was kind of that gap for us. So incomplete forms are a big piece that we would miss, maybe a date and time stamp or things like that. Illegible handwriting, not understanding which provider signed it, because it's signed like a physician signs, and sometimes that is not as legible to read. So we've implemented some options there. Consent's getting lost in the shuffle. So if a patient was moving from one location to another, that paper would travel with them. It might have gotten sat somewhere or left somewhere, and people weren't able to find it and had to spend time and waste time looking for a consent when one potentially could be available digitally. And then inconsistent forms, depending on when it was created or who maybe owned that specific form, they weren't always in the same format. So was looking for an option to consolidate those into one platform. So those are the reasons why we went down this path to even begin with. So things that we were needing to see, things that we were looking for, is what brought us to Interlace Health. So in looking at the technologies available, we needed something that was going to be automatic and digital and allow us to connect the product we chose to our electronic medical record. The other big piece for us was being able to customize our consent forms. We have our own legal compliance, our providers who wanted to be able to set the parameters for those consent forms and not use stock forms that were maybe available. So we were very, very specific on that piece of it. So when we were reviewing the options that Interlace Health provided, that was one thing that stuck out pretty prevalently to me. The other piece was adoption and something that was easy for our providers to get behind and make that change. So if any of y'all have ever gone through a paper process to a digital transition, that's a challenge to get people on board with moving from what seems to be easy with paper into something digital. People don't accept change all that easily, so I wanted something that was easy for folks to be able to jump on and get behind and use it because it was easy to use. And then kind of with the second bullet that you see on the presentation, we need to be able to customize it, but also just general management of forms, being able to use a system that allowed me to create them and have a great repository for those forms. So those were our checklist items. So we decided what we needed, or why we needed this process, and then what we needed. And all of those pieces led us to Interlace Health. So as we progressed through our implementation, we ended up going through a couple of different opportunities, but we landed on ultimately what Anne presented to you with what's called FormFast Go, where you're able to take that consent to the patient's bedside and can gather that consent very quickly through a scanned armband or a label and gather that signature. So that was the way we ended up moving towards for our consent process. So we had static forms that maybe just needed a signature, and those were able to be captured, but what we didn't have the opportunity for was checkboxes, drop-downs, dynamic, what we considered a dynamic form, being able to use that form in different ways. So that was one of the main things, because I could check mark something on a piece of paper or do different things, but how did I do that digitally? So really moving to that Go application is exactly what I say here. It was a game changer. The simplicity of the product and being able to grab that tablet, bring it to the bedside, do a quick scan and signature really was able to drive adoption for the providers who were using this. When I started going through the process to implement, I originally went down an operation and nursing path, thinking, let me get my nurse managers on board, my office managers. But then I realized that, wait, this is a provider process. I really need my providers engaged in this. So when I did my rollout strategy, I decided that I was going to focus on one department or one area at a time rather than doing a large implementation at once. And that really has been the main reason for the success in the areas where I have rolled out this product. So I started out very small, and actually in our inpatient wound care area, where they were able to take their consent and process that with my providers in that area, worked out the process specifically for them, made it ironclad, they were good to go. Then I moved to my anesthesiologist, worked it out perfectly with them. I had a provider champion who said, yep, we're going to work through this. Let's bring it on. I was in their area every day for a couple of weeks, making sure they were comfortable, training all those providers. Then moved into my cardiothoracic surgeon. So I just moved through different areas and really focused on provider engagement and provider adoption. And that really is what I believe led to the success of using the product in our system. The other great benefit, though, was that there was no more paper to scan in these areas. So nurses or clinicians who were having to not only maybe get the document pulled out, put a patient label on it, have it provided, they were also able to no longer have to do that piece, but then turn around and scan it into the system. So we took away a little bit of that extra paperwork they had to do to be able to refocus their time in other areas. So from here, we are continuing to roll this out into multiple areas that have a need for this, whether it's consents or just capturing that signature digitally to be able to transmit it back to our electronic health record. Those are our goals. Wherever we can eliminate that paper and that signature capture, that's what we're trying to accomplish. So I'm thankful for Interlace Health and the product that they've provided to allow us to get to this part. I appreciate y'all allowing me the time to speak today.
Thanks so much, Janelle. Our next topic is measuring the value, the ROI of transitioning to electronic informed consent. So you heard a lot of the benefits from Janelle and what they've experienced at Singing River, but I want to hear, when considering a new solution for your organization, what data points do you find most valuable? So the answers are now on the screen, and you can select cost savings, the impact on staff and resources, case studies, what other organizations like Singing River are doing, or ROI. And if you can check all that apply here. All right, let's take a look at the results. Looks like staff and resource impacts and ROI are really the most important, with what others are doing close behind. And I think that that's what we've seen with a lot of our clients as well. Organizations are really looking to streamline workflows and improve processes for their staff. So let's take a look at how you can measure the value and dig into cost savings and ROI. So when considered separately, these numbers may seem like the cost of doing business. However, together there can be a quantifiable impact to your bottom line. Interlace Health has compiled average national costs for printing, scanning, and shredding at 15 cents per page. Consent page lengths can vary, but the average is 2.5 pages each. So you're looking at 38 cents to create and process each consent on paper. And it's important to remember that many patients are required to sign more than one informed consent in a visit, so their per patient cost could be a lot higher. So next, I shared earlier that the NCBI study reported 25% of nurse time is spent on paperwork. The national average cost to employ a nurse is $89 an hour, which means that it could cost up to $267 per nurse shift just to manage paperwork. And then we also discussed how missing consents are the cause for 14% of surgical delays. If we looked at a hospital with 10,000 surgeries per year and used the JAMA findings that 1 minute in the operating room costs $37, we can formulate that this organization would lose over $2,000 a day as a result of missing consent forms. Can you imagine how this might add up in your facility? Well, let's explore these numbers for an organization like Singing River. With approximately 8,500 surgeries per year and over 153,000 adjusted patient days, we can estimate the annual numbers of patients signing informed consents to be around 62,000 patients, which would yield approximately 310,000 printed pieces of paper each year. So using these same numbers from the previous slide, the 3 cost categories of paper consents, the annual impact is astounding. At 15 cents per page, their annual cost just to process this paperwork alone would be over $46,000. Looking at an average of only 20 nurses per week who spend an hour and a half each processing or tracking down consents, the annual cost of the hospital to manage this paper is over $138,000. And there would be over 1,500 hours of staff time that could be redeployed to other areas for improved utilization. And finally, using that average of 14% surgical delays, it's nearly $1,700 per day lost, which adds up dramatically to over $440,000 per year lost as a result of informed consent errors and delays. In most cases, our clients are seeing a return on their investment in less than 6 months because of these ROI numbers. So the numbers that I've shared on the previous slide were based on national averages, but you can see the impact is measurable. Our team can work with you to understand the ROI you would experience from transitioning to electronic consent, just like we did with Singing River. Interlace Health offers a comprehensive platform to meet many of your digital needs, including remote patient intake and downtime solutions, in addition to informed consent that we discussed today. So we have experience in helping you transform your workflows by enabling seamless data capture and information exchange among your providers, staff, and patients. You'll gain all the efficiencies and overhead reductions without the expense or disruption of transitioning to a different EHR or adopting new software. Everything Interlaced Health provides comes with perfectly seamless integration and customization within your existing system. We've been around for nearly 28 years, and our customized solutions are at work in over 1,100 healthcare organizations, helping them reduce costs, accelerate revenue cycles, and improve the experience for patients and staff. And we'd be happy to chat on how we can help you do that as well. So now I'm going to turn it over to questions.
Well, I want to thank our presenters for their fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box that you see on your screen, and we will try to get through as many questions as we have. And we do have a few questions lined up here, so I'm excited to connect with our presenters on this. First, our attendee is wondering, does the patient receive an electronic copy of the consent, and is it sent to their email or stored in the patient portal?
I can take that one if you'd like, Desiree. There is always an opportunity to print that completed consent for the patient. There is a print button always available. In addition, of course, if you are, working or have an encrypted email system, you could email it. And thirdly, I think the question had to do with the portal. And, once it is archived to the patient chart, however you send those documents to the portal, it could be sent there, following that workflow as well.
Fantastic. Thank you for walking us through that. The next question from attendee is, this attendee is wondering whether the description of the procedure is written in layman terms or how that's presented within the system.
Yeah, I'm happy to take that one. This is Desiree. So we take your existing content that you have on your informed consents today, whether that's forms you've been implementing or forms you're building as part of our implementation process. And so it can be in whatever reading level that you prefer for your patients. And we do recommend that it's in a layman's terms, if you will, and we'll help you just plug that content in exactly as you have it. So absolutely understandable for patients.
That's helpful to know. Thank you. Another attendee is wondering whether the physician present during the informed consent, or is the physician just sign in? Who is explaining that to the patient?
Whatever your existing workflow. Oh, go ahead, Anne.
Nope. Go ahead, Desiree. I'm sorry.
Oh.
You go ahead.
Yes. Yes. Whatever your existing workflow is, that would be the same here. So in most cases, it is the physician who is reviewing the consent with the patient during a visit and walking through everything and having them sign there. We know in some cases they're going through those consents in the clinic prior to the procedure day, and perhaps the nurse is reviewing those with them. So that would be the workflow that we discussed, where that consent is signed by the patient and then is pending until the physician reviews it and countersigns it. But we build the process exactly like your current workflow.
Got it. That makes sense. Another question for either Desiree or Anne. Have you had any thoughts about a verbal consent during COVID-19?
Yeah, this is Desiree again. I'm happy to take that one. There's a handful of questions that came through that are all of a similar vein, moving towards remote consenting, consenting prior to the patients coming into the hospital, or over verbal consenting over the phone. And so again, as part of our implementation process, we really go through a lengthy discovery to talk through exactly how your facility consents patients now. So like I said, if you're consenting them in your clinic 2 weeks prior to the procedure, and that form is then getting archived and needs to be pulled up on the day of procedure, you might be consenting them in a telehealth visit and have a need to review the consent with them over the phone and then email the form to them after to sign through a digital user experience, or you might be consenting them on the day of procedure in the pre-op room. We will address any of those workflows and help you build that process the way that you need it. And so all of those are capabilities of our system. Anne, do you have anything to add to that?
No, I think you summed it up nicely.
Thank you. Sorry, Laura.
Oh, thank you. Yes, I think that was very helpful to know. And now one more process question here. Have you used a similar process for general consent to treat patients as they sign in as part of their admission process?
Sure, I can take that one, Desiree. Absolutely. So, the use case we showed today was an informed type of consent, that typically has to be a little more, sophisticated than a, consent that might need to be signed during admission, like a treatment consent, et cetera. But absolutely, the workflow using the mobile app, using, a mobile device to load a consent onto a mobile device for a patient to sign can absolutely be used at registration. Just the need to have such a dynamic form might not be there, but we can support both areas, both service lines.
Got it. That's very helpful. Another question we have coming in here is asking, how long did your implementation process take? Did you do clinical departments one by one or roll it all out in one install?
Hey, this is Janelle from Singing River. I can speak to that for what we did in our situation. So to take the first question about how long implementation took, we did around a 4-month process to implement our Go solution. And I say it took around 4 months because that was to do the application setup and configuration, but then I honed in on one department specifically, really customized their consent forms to make sure they were appropriate for them, and roll that out to a single department. That's the second question, was if we did clinical departments one by one or all one install. I found the way for our success for our specific system was to do it clinical departments one by one rather than everybody at one time, because that allowed me to dedicate my time and resources to that group. I could optimize their consents, their processes, and make sure I gave them the attention they needed to be successful.
Thank you so much for walking us through that. The next question we have here is, how well does this process work in a research environment?
Yeah, this is Desiree. I can take that one. We do have a solution for clinical trial consents. Obviously, the workflow is a little bit different and is often, there's a need for more of a remote environment because the patients might be, the participants of the trial might be remote participants. And so the workflows look different, but it does work well in that same environment. Similar process. They're often much longer consent forms, up to 25 plus pages for research trials. And so we really create a user experience that works well for the patient to be able to do that on their mobile phone or tablet from home, or to be done on a tablet or computer in the clinical space with the research coordinator. So happy to talk more with that individual who asked that question if you want to dig into research consents more.
That makes sense. The next question, Janelle, you might be able to answer this one or respond to this one. What do you do for non-English speaking patients?
Absolutely. So we have kind of two different processes. We might either take a form and have it translated appropriately into the other language, or if it is an English form, we will indicate that if a translator was used or something along, or an interpreter was used something along those lines. So it depends on the situation for different forms and how we've approached that, but we do try and capture either it in a translated type form or to indicate the interpreter.
Got it. And then one more question, Janelle. Do you provide standardized content for the consents or for various procedures?
So we try to stay standardized in the sense of the format of the form. So the way that it's laid out, the way that it's structured, the way that we have the content presented, but the actual information per procedure will vary based off of the procedure that's being performed or patient specific. So there is some standardization, and Interlace Health, with the way that the form designer works, allows us to really continue with that customization and the standardization, but there are some variations within each consent for the way that I personally build them for ours.
And I can add on to that, Laura, and say that Interlace Health can help provide those sort of best practice form templates that many of our clients have used, and in some cases, some of that standard content for some of the most common procedures, just to help organizations get started who maybe haven't built out procedure-specific content before, so we can help with that process.
Perfect. Thank you so much for clarifying that. Next question I have here is, attendee is wondering, what EHRs do you work with? And especially when you're looking at inpatient versus outpatient, can the system work with two different electronic medical record platforms if the health system has that?
Sure, I can take that. We really are EHR agnostic and can, work with and integrate any EHR. Haven't really met one that we can't work with. So, depending on, whatever that EHR is or the process by which forms are archived, might differ depending on the EHR, but we can send completed forms anywhere.
Got it. That's helpful to know. And I know we've touched on this a little bit when Janelle was talking about how she handles non-English speaking patients coming in, but from the Interlace perspective, can you customize the forms with any specific language, or how do those capabilities work?
Yeah, I can answer that one too. We can certainly build out forms in different languages. We don't necessarily do the translation for you, but if you get us, a template of a form in a different language, we can, design that and put that into an electronic format.
Oh, perfect. The next attendee question here is, how do the right forms get launched when patients are scanned?
I can answer this one from a personal perspective. So the way we have ours set up in the Go system is once the barcode is scanned, there are consent available options that the provider can then select. So we have ours categorized by specialty, and they can go through and choose one or multiple consent forms that are appropriate for that patient's care, and then launch those for signature.
And just to add on
to build
a
on,
little bit.
Oh, yeah. Go ahead,
I think
Ann.
we're probably
going to say the same thing. Yep.
Yeah, I was just going to say consent can also be launched from a physician or provider order. So we can, Interlace can receive a message when an order is placed. For example, if you're going back to the use case today, when that orthopedic procedure order is placed, the consent can automatically be teed up for the patient and waiting, when that barcode is scanned via the mobile app.
Perfect. Another attendee is wondering, what mobile devices are you compatible with? This attendee already has the WOWs. Does your software work with the mobile workstation?
Sure, I can take that. Maybe Janelle, you can add on, what devices you're using. We are, and as far as the WOW, it really would depend on, what the process would look like would really depend on the type of devices that you have on your WOWs, whether they are touchscreen, or not. If you are working on a device that is not touchscreen, so, patient can't apply their signature, there are other options there using, an external signature pad. But as far as devices, we are compatible with most devices. Just the patient experience might look a little differently depending on capabilities of that specific device.
Yeah, and I can tack on to that for what we personally do. We did look and explore at what the WOW and Topaz signature device might look like in certain environments, but we ultimately landed on using iPads for our tablets in our clinical areas.
Yeah, and I would say that, what Janelle just said mostly is what we hear. Certainly, as I said, you can use a WOW with a Topaz device plugged in. It just might not be optimal in a lot of areas. That cord would have to be long depending on if the patient's laying down, sitting up. So, best practice and probably most efficient and streamlined is mobile device, iPad, tablet, etc.
Perfect. And then the next question is particularly important in this day and age. How do you sanitize the devices?
So I can take this one just as an experience from what we've seen over the past couple of months. I will say that being on a tablet has been a benefit to our providers. They feel like that's an easy, hard surface they can wipe down with available solutions in their area, usually like a purple top type wipe or something along those lines that's approved in their area. But they have found that being able to wipe down that hard surface in this situation has been a lot more beneficial than having a piece of paper that really can't be wiped down too easily and passed along from area to area. So that's what we've done with both our tablets and our stylus being used.
Well, thank you so much for your time today. I'm wondering if Janelle and Desiree, if you have any last words or thoughts before we finalize the presentation.
Yeah, this is Desiree. I can definitely share there were a handful of other questions that we weren't able to get to, or they were very similar to one of the questions that we had already answered, but just wanted to reiterate that Interlace Health really works on customized solutions that are built for the client's needs. So if you have a workflow, you're a children's facility and you need guardianship signatures, we can work that out. If you have you're consenting in the clinic prior to the visit, we can work that out. If you have telehealth needs, we'll work through that with you. So it's a fully customized solution to meet the needs of your facility and your clinician's workflow. But if anyone has additional questions and they want to reach out to us directly, they can reach out at interlacehealth.com/contact. And I also want to say we're super grateful for Janelle for taking time to talk through how they've implemented it, Singing River, and the great success that they've had there.
Thank you so much for having me.
Well, I wanted to thank all of our presenters today for their excellent presentation and Interlace Health for their sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.